This little girl is fighting for her life in Apac district in northern Uganda. Nancy Ayo is just 2.5 years old. She was rushed to the district hospital 2 days ago after suffering a severe bout of malaria. The medical workers here put her on oxygen to save her life.
When she was brought, she was badly off. We checked for HB. The HB level was 5.8, but we decided to put a blood transfusion because she was very weak. But now there is slight improvement, and we have decided to put her on oxygen therapy.
The medics say that they have received many similar cases to Nancy's in recent months.
2 weeks ago, we had 2 cases in these 2 beds, and they recovered. We put them, most of them were having malaria and severe anemia. Then they end up getting dyspneic, and we put them on oxygen therapy, then a blood transfusion, and the antibiotics plus antimalarial. Then they recovered.
A cold chill ran down my spine as I walked around the children's ward at Apac Hospital to find the wards filled to capacity. All the children who have been admitted here are malaria patients. Many more line up in the hallway waiting to see the doctor. Although some of the babies have recorded some improvement, many of them are still in a worrying state. Because of the inadequate space and increasing number of patients with malaria, some of the wards here at Apac Hospital are not enough to cater for all. Some of the patients have now resorted to using shelters such as this mango tree for assistance.
The number of patients are more, and on the floor, at night when you come, you cannot easily move around.
According to the hospital records, the number of patients with malaria has shot up significantly over the past 3 months, from less than 1,000 patients to about 3,000. 96% of the people admitted here are malaria patients. According to America's Time magazine, Apac district has the world's most incidence of malaria. Studies by health experts also show that 1/4 of the district's population is afflicted with the disease. Research by the Malaria Consortium Uganda, a non-profit organization that specializes in the prevention and control of malaria, also singled out Apac as the town with the most infectious mosquitoes in the world. Apac hospital officials are worried of the growing number of patients that come by the hour.
Most of these patients, they prefer coming to the hospital, and yet some of these cases also can be handled at the lower health facilities.
They also want government to increase its support to the district.
And apart from drugs, also we have these testing materials. Some of them also run out, and still we get it from the lower health facilities, and it brings in then inefficiency in testing this malaria, for example.
The district health officials in Apac say that they are doing their best to contain the situation.
As a district now, for the time being, we are emphasizing on community education and sensitization. We are emphasizing on early treatment and of course, availability of essential medicine.
The Uganda Red Cross Society in Apac has made a series of interventions by introducing motorcycle ambulances to help people take their ailing patients, especially women and children, to the district referral hospital.
Now, since it is community-driven and we have provided the ambulances, we have formed them into groups, we have supported the groups with some revolving fund, and we have formed them into ambulance management committees. They will be able to put in good use.
Villages there, some of them just suffers locally within their localities due to lack of transport facilities to connect them direct to the health facilities.
At least 29,000 people have been diagnosed with the disease since the beginning of the year. Suhail Mugabi, NTV Weekend Edition. Suhail Mugabi, NTV, Apac District.